see if we can make it look a little bit clearer. But I'm happy to spell anything that you can't read or take the time to make sure that you guys can understand what's written up there. All the handouts that we drew from last class are online, and as well as the videos. And one of the advantages is I get to go back and look to see what we talked about. And when I did that, this time I realized I left out a word up here. Okay, one word that should go over the PNS motor. So PNS sensory, that's considered afferent information. Does anyone know what the PNS motor information is called? Efferent. Good. All right. I just want to make sure everybody's on the same page. This is efferent. E-F-F-E-R-E-N-T. So afferent information is coming in from PNS into the central nervous system, and then the central nervous system interprets that information and then puts out information, puts out an appropriate motor response. When it puts out the motor response, that's called efferent function for the PNS. Okay, just wanted to go back and clarify that. So, moving forward, let's talk about CNS blood supply. One of my favorites. Okay, I'm not gonna be able to get the whole thing in here, but I'll start down the bottom. Okay, we'll start here with the CNS blood supply. So here, the colors are going to be important. I'll try and stick there. There's two main parts of the blood supply. The vertebral basilar system I'm going to stick with as a greenish color, and the interior blood supply I'm going to stick with as a reddish color. So hopefully you can see that. And how much, did you guys cover blood supply at all with Dr. Blair?
Yes.
Yeah, did you talk about blood supply to the CNS at all?
No, let's stop at the common carotid.
Just mention.
You stopped at the common carotid.
Oh, no, sorry, internal.
Okay, so you stopped at the internal and external carotid. Okay, well good, then this first part should be a little bit of a review, and this is my rendition. This is a heart. Okay, now coming off of the heart, there's the first major blood vessel, and let's go ahead and label this. So this is the, what's this major blood vessel that comes off the heart?
Aorta.
That's the aorta. Good. That's the aorta. Okay, and that would make this the left side, right? And that makes this the right side. Okay, so that's where we're starting. We're starting at square one, right with the heart, coming off the aorta. Now, starting on the left side, the one that's more lateral, it's going to come off here. Does anyone know the name of that blood? Yeah, great. That's the left subclavian. So that's left subclavian. Perfect. Okay. On the left side again, just a little bit more medial, there's another artery that comes off and fits in this space here. Does anybody know the name of that artery? Yes, that's going to be your left common carotid. Okay, Dr. Blair did a great job. On the left side, anyway. Now, moving over to the right side, coming off of the aorta. Sorry? Yeah, right, it's a brachiocephalic. So it's going to be your brachiocephalic. The brachiocephalic comes off as one and then divides into two. Okay, so this here is your brachiocephalic. Awesome. Everybody see where we are? So far, so good, right? Nice and easy. So it's your brachiocephalic trunk, and then your brachiocephalic trunk on the more lateral side here breaks into this artery. Does anyone know what that one is? Yeah, that's going to be your right subclavian. Good. That's your right subclavian here. Okay, and a little bit medial to the right subclavian is going to be another artery Right, that's going to be your right common carotid. Okay. So for review, you have the heart, major blood vessel coming off the heart, the aorta. On the left side, you have your left subclavian and your left common carotid. Then you have your brachial scalp trunk on the right side, and that divides into right subclavian and then right common carotid. Now, there's a major blood vessel that comes off of the subclavian. Okay, this is the major blood vessel that comes off the subclavian. Is going to be an important blood vessel for the formation of the vertebro-basilar system. That's going to supply blood to the back of your head in general. So brainstem and back of your head. Does anyone know what artery that is? This is the vertebral artery. Perfect. Okay, so I'm going to have the vertebral artery coming off here, and it's going to go straight up. Like I said, this is the vertebro-basilar system, so I'm going to try and keep it in green. Okay, so this is that good? Yeah. So this is your left vertebral. Yeah, I ordered new markers, so you should get them everywhere. Okay, so in the same way, on the right side, coming off the right subclavian, we have another artery here. Which one's that? Right vertebral, correct. So here's the right vertebral. So when you look at the arteries coming off the aorta, on the left side you have your left subclavian. That branches into your left vertebral. On the right side you have your brachial scalp trunk. Right subclavian, that branches into your right vertebral artery. And like I said, the vertebral artery coming off the subclavian on both sides is going to be the major blood vessel coming to supply circulation to the posterior part of your brain. Moving up, and what happens here, okay, is the left and right vertebral travel up and then come together in the middle. We'll talk about this in a minute, to at about the level of something called the pontomedullary junction, which is nothing more than the place where the pons and the medulla abut. Okay, they come together at that point. So the left and right vertebral arteries come off the subclavians and they travel straight up, and then they start to come to the middle, and they come in the middle and they form one artery right here. Does anyone know what that artery going up would be? Vertebro-basilar system. That's going to be your basilar artery. Okay, B-A-S-I-L-A-R, that's your basilar artery. Again, this is a big overview coming from the heart, just the start. We're going to go into fine detail for both the vertebro-basilar system as well as the anterior circulatory system. Questions about that? Okay, coming off the subclavian, you have your vertebral arteries. Vertebral arteries travel up toward the brain, come together, form one main artery called your basilar artery. And that's the beginning of the vertebro-basilar system. Good? Yeah, Ellie? Basilar, B-A-S-I-L-A-R. Basilar. Oh, we'll see it again. At least 5 more times. Like I said, this is just a big overview, just getting started. So everybody got a feel for what's happening? Can you see this? This is just coming up and going, and we're going to come up and supply back here. Okay, that's the vertebro-basilar system. Now we have this other part to worry about here. Coming off the left common carotid, it's going to branch into two different things. We're going to have an artery that goes that way, and then it's going to have an artery that branches more to the outside. Does anyone know what those are coming off the common carotid? Correct, yeah, so that's going to be your left internal carotid. Okay, and then over here, more external, is going to be your left external carotid. Okay? So nothing new. Hopefully you got that anatomy as well. So coming off on the left side, coming off the left common carotid, two main branches, the left internal carotid and the left external carotid. Same thing here happens on the right side. The right common carotid separates into two arteries. I'm just going to bring this out here so you see it a little bit easier when I write it. More medial of the two is going to be your right internal carotid. Okay, and then more lateral is going to be your right external carotid artery. Okay. Everybody got it? See what's happening? Can anyone tell me, is it the internal or the external carotid that's going to supply blood to the anterior portion of your brain? What's the main artery? Which one? Internal or external? Internal, correct. It is the internal carotid artery. So what happens is the internal carotid arteries just travel straight on up. Nothing fancy. And they're going to supply blood to the anterior portion of the brain. We're going to talk about that. Okay, so the internal carotid artery, coming off the common carotid on both the left and the right side, is going to be the one that supplies blood to the anterior portion of the brain. Questions? Give you a minute to. Yes, question?
I know there's like redundancy like in the brain itself, but if any of these like vessels were like cut off for any reason, would there be like hypoxia just because like one side cut out, and you still have the left coming in?
There's something called the circle of Willis, which we'll talk about eventually, but in general, if you have a clogged carotid or a vertebral artery, you're in bad shape. So, which is why they, usually roto-rooter, if they find out that there's a major clog, they'll go in and clear out the area. Any other questions? Let's see where we are. Okay, let's move on then. The vertebro-basilar circulation is the next one, and that's this slide. And as I mentioned way back when, full disclosure, I'm a terrible speller. This should be an E here, vertebro-basilar. Okay. One of these days I'll remember to correct it, but it's been there for a while. Vertebro-basilar circulation. Okay. What you see here, sort of looks like an alien, I guess, is I've taken the brain stem. So this is just the brainstem, and you're looking at the brainstem straight on. So if you were looking at this picture, we'd be looking like at me right now. Okay, my brainstem part that I'm showing is in the front. Okay, so there's something behind the brainstem that we talked about before. It's a region of the brain that's responsible for balance and coordination. Cerebellum, good. All right, just want to orient everybody. So this is going to be my cerebellum. What I've done is I've just removed the cortical region. I've just not included that overall. Okay. So like, You get it?
Yeah, I get how it looks now.
Okay. Yeah. It kind of looks like an alien because of the eyes.
Yes.
Now, looking at this, what I said, this is the region of the brainstem, and this is the brainstem connects. This is spinal cord down here. Okay. Lowest most portion of the brainstem. Does everybody remember?
Medulla.
Yeah, that's the medulla. That's your medulla here. Okay, and then the big bulbous one in the middle, what's that one called? That's your pons, good. Now moving on up, the uppermost portion of the brainstem is midbrain. And this is just a section, a transverse section through the midbrain, or the top of the midbrain, really. Okay, is everybody oriented? So, like I said, you'd be looking at meat right here. So we're talking about the front of the brainstem, and the cerebellum's in the back. Okay, this is the vertebro-basilar system, and I think it's a little bit more complicated than the anterior circulatory system, which is why I like to bring it up front. We'll do the hard stuff first. Thinking that this is the midbrain, and if I told you this is a cranial, these eyes are cranial nerves. It's really an important landmark for the vertebro-basilar system. Would anyone know what cranial nerve that is? How about the third cranial nerve? Yeah, it's third cranial nerve. Oculomotor. Okay, this is going to be cranial nerve number 3, which is your oculomotor. I'll just put CN3. And this is your oculomotor cranial nerve. Really important for a lot of eye motions, the majority of your eye motions. We'll talk about that later. But it's an important landmark for the exiting of 2 main arteries off the basilar. Okay, does everybody see where we are? And we're going to pull brains next Wednesday, so a week from today. So we're actually going to be able to see, which I think is really super cool. When you pull the brain, you're going to look at the front of the brain stem, and you're going to see all these arteries we're about to draw in here. The other thing you're going to see is a lot of cranial nerves, and cranial nerve 3 just sticks right out at you. They're like 2 stalks coming at you. Okay, so these are landmarks that we're going to be looking for. All right, now let's look at this system here that we started down below. I had mentioned that there's something called the pontomedullary junction, and let me write that in. And the pontomedullary junction is nothing more than this region where the pons and the medulla connect. So it's called your pontomedullary junction. Right? Makes sense. The pons and medulla are coming together at that point, and that has a name. Your pontomedullary junction. It's another important landmark for the vertebral basilar system. And as I said before, the vertebral arteries, so let me label this here. So this is going to be the left side, okay, and this is going to be the right side. Just want to make sure that you're oriented. Okay, and then coming up here, you have your vertebral arteries. So you have vertebral artery on the left side, and you have a vertebral artery on the right side coming up. There's a pair of them. So this is going to be your left vertebral. And this is just a continuation from where we were before. So you have your left vertebral, and then here's your right vertebral. Right, coming off the subclavian, left and right, vertebral artery comes off, and they both travel up to the brain, and then come together at about the level of the pontomedullary junction. Okay. Form one main artery that goes straight up and bring it all the way up here. is just nothing more than a little bit more detail than what I just drew. Okay, the right vertebral come up, come together, form one main artery. They go straight up the middle of the brainstem, and this is your basilar artery, B-A-S-I-L-A-R. Hence the vertebrobasilar circulation. Okay, two main arteries that form it. Yes.
What was the name of the artery?
Which, so the left and right vertebral come up, and then they form the basilar artery, B-A-S-I-L-A-R. That artery is going to be the one artery that's formed by a junction of left and right vertebral at about the level of the pontomedullary junction. Any other questions? Anything else unclear? Okay, now, moving on, what happens is just above the level of the third cranial nerve, this guy right here. So we're going to be above the level of the third cranial nerve. The basilar artery splits off into two. Okay, on the left side has something going out like that and goes back. And then on the right side, something comes out, and goes back. So just above the level of the third cranial nerve, the basilar artery splits off into two different arteries on the left and right sides. Does anyone know what artery that is, by chance? It supplies your occipital lobe with blood. It's called your posterior cerebral artery. So here's your left posterior cerebral artery. Okay, and posterior cerebral artery is typically abbreviated as PCA. So that's your left PCA. PCA supplies your occipital lobe with blood. We'll see that toward the end of the talk. And on the right side, we have your right PCA. This guy right here. Okay. So left and right PCA. So vertebral arteries, left and right, come up, come together in the middle, about the level of the pontomedullary junction. Form the basilar artery. Basilar artery goes up about the middle of the brainstem, in front of the middle of the brainstem, just above the level of the third cranial nerve, splits off into two arteries. One goes right, the other goes left, and those are the right and left posterior cerebral arteries. Question? You did? Okay. All right. That's the main part of it. Let's look at my little purple here. Okay. This one isn't important as far as the color is concerned, but let's talk about what arteries come off, what other arteries come off the vertebral as well as the basilar arteries. I'm starting way down here, coming off the vertebral artery. I'm going to make mine purple. Doesn't really matter as far as the color, but it's going to be something different. Coming off and then coming straight down. It's going to be the formation of, does anyone know what artery supplies the anterior 2/3 of the spinal cord with blood? That would be the anterior spinal artery. So this is your anterior spinal artery. Another way you can abbreviate that ASA. Okay, so the first artery pair that we see coming off the left and right vertebral comes down and meets in the middle, supplies the anterior 2/3 of the spinal cord with blood. That's your anterior spinal artery, can be abbreviated ASA. Okay. Part of the central nervous system since it's the spinal cord, but it's not your brain problem. Right? Now, there's another couple of arteries. I'm going to keep with the kind of the greenish theme. Coming off the vertebral artery, you have one on the right and the left side. Here, it's going to supply the posterior inferior surface of the cerebellum with blood. On the right and left side. Does anyone have any idea what that one might be?
Posterior cerebellum.
Not cerebral, so it's called, it's called pica. P-I-C-A. So, lots of things in there. So this is going to be your left pica, P-I-C-A. Pica stands for posterior inferior cerebellar artery. Okay, it makes sense. If you look at the picture, it's supplying the posterior, backside, inferior, lower side surface of the cerebellum with blood. So it's called pica, posterior inferior surface of the cerebellum. And then that's on the left side, and there's also one on the right side. So that's going to be your left pica, and this is going to be your right pica. Okay. So two main arteries that are important to know that come off the vertebral artery are going to be what? Pica and what's the first one? ASA, anterior spinal artery, and pica come off vertebral. Okay, let's move up to the basilar. Now, important arteries to know that come off of the basilar artery. There's a couple. So just here, I'm going to put it up here. Pica has a sister. Pica's sister's name is Ica. Anybody have any idea what Ica might stand for? Anterior inferior cerebellar artery. That's correct. So we have a left Ica, A-I-C-A, and we have a right Ica. Okay, and again, Ica is anterior inferior cerebellar artery. Person had a problem, had a damaged or had a stroke that affected their Ica. What kinds of signs and symptoms would you expect? Yeah, balance and coordination deficits. Very good, Bryson. You're welcome to say it out loud. That's perfect. I know. It's terrible. Yeah, you're going to have balance and coordination deficits. That's exactly what you'd expect, and that's kind of the point of all this. I mean, the blood supply is going to be really important for it. If you know what artery has been affected, then you can kind of predict patient signs and symptoms. It really helps to know what you're going to do for your patient examination if you can have a feel for what they're going to present like before you even go in. Any questions about that? So coming off the first two that come off the vertebral system, ASA, anterior spinal artery, and then pica. Then coming off the basilar artery, the first one that we're seeing here is left and right Ica. And then another one just below the level of the third cranial nerve, there's a third artery that comes off. And it's going to supply the superior surface of the cerebellum with blood. Markers are running out. Yeah. So it's going to supply the superior surface of the cerebellum with blood. What do you think it might be called? SCA, superior cerebellar artery. So that's going to be your SCA. Let's see if I can make that a little darker. Supplies the superior surface of the cerebellum with blood. That's going to be your superior cerebellar artery. I'll label it over here on the right side. So this is going to be your right SCA. SCA stands for superior cerebellar artery. Questions? Make sense? You see it? So left and right, yes. Gabby?
For the SCA, which arteries that come off the
The
base?
basilar, yeah. So you can see it right there coming off the middle of the basilar. The basilar has, well, I guess you can say three main branches, because PCA too. So you've got the ICA, SCA, and PCA. Back. Any other questions? Those are the main ones that we're responsible for. There's also one other small little bunch of arteries, and these come off the basilar. It's not a major set of arteries that's going to supply a lot. Its job, or these arteries, just supply a little bit of the medial pons, and they're very small little branches coming off the basilar. But since they do supply the medial pons and can be disrupted and cause patient signs and symptoms, I like to talk about them. And these are simply called pontine arteries, Pontine. Okay, these are your pontine artery, and they're just little branches coming off the basilar that help supply the medial pons with blood. Pontine, Pontine. Those are your pontine arteries. So to give you a feel, when we pull brains next week, if you have some really good circulation in a person, you on the brainstem when you're looking at it, these major arteries that I've diagrammed here can look like garden hoses. They're quite big. They're quite well developed. They're really easy to point to and identify, and I like to go around and help you guys identify what they are and what you're looking at. The pontine arteries, you really wouldn't see them. They're just kind of medial pons, and that's it. But the other ones, we're going to be able to see all these. Questions? And so what happens is, I've diagrammed it here, so the basilar comes up, and above the level of the third cranial nerve goes backward. So that's what those arrows mean, it's just going backward to supply the occipital lobe with blood. And we'll talk about that a little bit later on. So essentially, your cerebellum in the back of your head, your brainstem, as well as your occipital lobe are supplied by the vertebrobasilar system, posterior system. This is the more complicated of the two. That's why we start here. Questions? Okay, let's move forward then. This is the next one is the anterior pontine, yeah. This is anterior circulation. Let's see if it goes. Doesn't quite respond when I move, but come on. There we go. Okay. So now we're going to look at the anterior circulation first. Okay, that's where we're going to start. And like I said before, I like to keep my colors consistent. So when I'm working with the anterior circulation, I'm going to choose to use red so I can keep things together. So you're looking at this guy right here is a face. Let's see how you see it. So this would be, if it were me, it would look like this. So this is his right side. Okay? It's important to get the three-dimensionality of it for what I'm going to draw. But I'm going to start with the right internal carotid coming up off the common carotid to start the system. So everybody got that? See what I'm doing? One artery at a time. I'm only going to start with the right side because it gets complicated. So we have the internal carotid, like I showed before. The internal carotid coming off the common carotid on the right side is going to come up here to about the level of the eye before it does anything. So we're going to come here, and this is your right internal carotid. Everybody see where I am? This is just a continuation of where we started with the heart. All I did is come up with that internal carotid, and now I'm bringing it up to the level of the head. And the right internal carotid is going to go all the way up to about the level of your eye before it does anything. From there, it's going to form two major branches. The first major branch is going to swing forward and actually flip over the corpus callosum that we talked about the other day. Okay, and you'll see this again. But I'm going to form this is the first major branch off of the internal carotid on the right side. Okay, just the right side right now. Okay, so any thought? Does anyone know what the first branch off the internal carotid is going to be? That's going to be your anterior cerebral artery. So this one right here is going to be your right anterior cerebral artery. And that one is abbreviated ACA. Okay, internal carotid on the right side comes up about the level of the eye, forms a branch that shoots backward over top of the corpus callosum. Okay, that first main branch is going to be your anterior cerebral or your ACA artery. Okay, only one more branch to worry about. Real simple. Okay, there's going to be another branch at about the level of the eye. There's going to be another branch that, this is me, it's going to come off and then it's going to come out toward my ear. Okay, talk about where it comes out exactly, but I'm going to try and picture that by showing that it comes this way, and I'm just saying it comes off and then comes straight out my ear, and that's going to be your middle cerebral artery. So this guy is your right middle cerebral artery, and that's MCA. So, right internal carotid comes up about the level of my eye, forms a major branch over my corpus callosum, and at about the level of the eye as well, there's another major branch that comes off, that's the MCA, and that comes straight out toward my ear. The MCA is going to supply the majority of the lateral surface of my brain with blood. We'll look at the territories here in a minute. But you got the AC, simple system, internal carotid, ACA, MCA. Right? That's your anterior circulatory system. Any questions? Did you have a question, McKenna? No? Everybody good? All right. So that's the right side. Like I said, I like to separate it first, right first, and then we're going to draw the left in next to it. So the left one here, I'm going to write over my middle cerebral artery. This is the left side. So this is going to be my left internal carotid coming up in parallel on the opposite side. Okay, so the left internal carotid comes up on the left side. So if you can imagine, I'm trying to draw 3 dimensions here. About the level of the eye, it's going to flip over the corpus callosum like that. And what branch is that on the left side? What branch flips over the corpus callosum? Yeah, that's your ACA, right. That's going to be my left ACA. That's my left anterior cerebral artery. Okay. Then I'm going to have another major branch coming off the left internal carotid that's going to go out through my left ear, and I'll try and draw that by a little dash. This means it's going out through the back, through the ear on the left side, and this is going to be my left MCA. Left middle cerebral artery. So everybody got it? See what's happening? Trying to do three-dimensional here, so it's just left and right sides coming up, flipping over, and coming out. Side of the ear. Questions? Make sense? Okay, so let's go ahead and add on to this, and let's look at the vertebral system at the same time. So in addition to the anterior circulation here, I'm going to put the vertebral system in. And the vertebral system, on the right side, I have these arteries coming up off the subclavians. Anybody remember the name of those? Those are your left and right vertebral arteries. Great. Okay. So this is going to be my right vertebral. And this is going to be my left vertebral. Okay. At about the level of the pontomedullary junction, the vertebral arteries come together to form one main artery. What's that one called? Does anybody remember? Yeah, that's your basilar. Great. That's your basilar artery. Basilar, B-A-S-I-L-A-R. Okay, and we're just looking at the cortical region right now. We're not going to worry about the arteries coming off the basilar, except for that one that comes off at the top. Okay, so basilar artery rises just above the level of the third cranial nerve, forms two main chutes that flip backward to supply the occipital lobe with blood. Draw those in here. You can imagine the occipital lobe's back here, back portion of the brain, right? So, which arteries were those again? Yeah, this is your left. This is going to be your left PCA, posterior cerebral artery, and this is going to be your right PCA. Great. Now you can see anterior circulation is going to supply the front part, posterior circulation is going to supply the back part, plus the cerebellum and the brainstem. But something really cool happens, something called the circle of Willis. Has anybody ever heard of the circle of Willis before? Yeah, okay, what's the circle of Willis? Does anybody know what it does? It circles, yeah. It actually completes the circle of circulation. There are just 3 arteries, remember, that connect all these together. Okay, the first artery that we're going to look at is just a little artery here, and again, we'll see it on next Wednesday. There's a little artery that sits right here, and it connects the left and right halves of the anterior circulation together. So it connects the right and left halves. It sits right here between the 2 ACAs, and its name is, oh, I can find the color. This is called, so since it connects it together, it's going to provide communication between the left and right halves of the brain. So this is called, and there's only one of them, your anterior communicating artery. Okay, so its job is to communicate or to connect the left and right halves of the brain. There's only one of them. Okay, other parts to the circle of Willis that we can draw in here. Connecting the right PCA with the internal carotid, there is an artery here. I'm going to try and draw it there. Okay, so connecting the right internal carotid with the right PCA and connecting the left internal carotid with the left PCA, there is a pair of arteries. These connect the anterior circulatory system with the posterior circulatory system. As you can see, the red's connected to the green on the left and right side. Okay, and these are your posterior communicating arteries. This one here is going to be your right posterior communicating artery, and then this one's going to be your left posterior artery. Okay. Does everybody see that? I think it's important to see it, to visualize it. We're going to look at, this is looking, like I said, from the side. You know, when I was learning this myself, I had trouble seeing it from the side, so I like to visualize it from above, which is what we're going to do here in a minute. But I need to see if you have any questions about this. Can you see how the posterior communicating arteries connect the posterior circulatory system with the anterior circulatory system, and the anterior communicating artery connects left and right halves of the anterior circulatory system? That helps to make a big circle. So essentially the circle of Willis is the connection, or this big circle between everything. Questions? Good? Is it nap time? Maybe it's time for a little hacky sack. Yes, go ahead.
So there's only one anterior and there's two posterior.
Correct. One anterior communicating artery resides between the two anterior cerebral arteries, connects those together, connecting left and right. Remember, the MCA is left out. It's just going to sit here and pull out the ears. We'll look at it from above in a minute. Ellie?
Is it circle of Wills or Willis?
Willis. We're going to look at it in a minute. So yeah, I'll write that down on this page too. So this is called the circle of Willis, W-I-L-L-I-S. So it's a way for your brain to connect left and right, anterior with posterior, anterior with vertebral basilar. Okay, let's go ahead and take a 10-minute break. So regroup here, please, at 1:58, because we still have lots to do.